Land is closing, basketball canceled, no St. Patrick's Day parade, all because of coronavirus. And what a lot of people are asking, is this really necessary?
It is a tough question, isn't it? So let's not answer it ourselves. Let's take it to the professionals. FOX46 getting results for you and hoping to ease your fears by giving you some facts about coronavirus with Dr. Deb Matthew. Let's start with, you've been in a couple times now talking about coronavirus, and the information changes, the recommendation has been changing.
Yes.
Daily, exactly. When you talk about coronavirus versus the flu versus allergies, just to kind of give people an overall also, what are we looking at in terms of the symptoms and the differences?
Right, so for coronavirus, what we're looking for is flu and cough and trouble breathing. And typically it's a dry cough, so a wet cough would be like you're coughing up mucus. So this is typically a dry cough, but the cold virus settles in your nose. The coronavirus settles in your lungs, and so that's why it can cause trouble breathing. The flu, you can get the fever and the cough, but you also get the headache, the achiness, the sore throat. And now allergy season is about to start too, so you don't usually get a fever with allergies, more the itchy nose, itchy eyes, runny nose.
Okay, so if you're not sure, I mean, I think right now we're at the place where the fear is so high, the minute you cough, the minute you feel something's abnormal, oh my God, I got coronavirus. So if there is that fear, we don't want people to freak out.
We don't want people, there's no need to freak out.
But we also don't want a mad rush at every clinic across America. So what do you recommend people do?
So if you're concerned, for most people, this is just going to be a mild illness. But if you're concerned, call your doctor. They will ask some screening questions over the phone, and they'll give you some advice. Do you need to come in? Should you stay home? And what they're looking for is fever, cough, and trouble breathing. And what you might be told to do is, if they're concerned about you, is to come on in, and a staff member may actually end up meeting you out in your car in the parking lot. And typically what they may do is start off by swabbing you for the flu. If you test positive for the flu, well, then we'll treat you like we normally do the flu. If you're negative for the flu and you meet a couple of criteria, then they may test you for the coronavirus. So what we're looking for is, do you have the right symptoms? And are you a high-risk person, meaning have you traveled out of the country? Have you been exposed to somebody else that we know has had the actual COVID-19? And if that's the case, then they will either swab you for the coronavirus if they have the test, or let you know where you can go to get the test done.
So this is something that they can take, when people are wondering what to expect from the test, both for the flu and for COVID-19 for coronavirus, what is the test? What do people need to be prepared for?
It's a nasal swab.
A nasal swab, okay.
Well, and so I think the next question that we were hearing this morning on Facebook is, why are we canceling all these events? What is the connection there with the spread of the virus?
So this is not fear and hysteria causing everything to cancel. This is social responsibility. So for the vast majority of us, 8 out of 10 of us who actually get the virus, it's not going to be such a big deal. You'll feel crummy and then you'll get better. But for the medically vulnerable among us, the elderly, people with underlying heart and lung disease, reduced immune system function, they can get quite sick. And we don't have a medicine, we don't have a cure for this. So our best bet is to try to help protect people from getting sick. So where this is different than the flu, we don't cancel basketball for the flu, right? But where this is different is with the flu, you get the virus, you get sick, you stay home. Here, you can get the virus and you can wait, it can take 5, 9, up to 14 days before you get sick. And you're most contagious while you're sick, but we believe that you can probably even start spreading it earlier. That's why we're trying to get ahead of these big crowds.
And this is far more contagious than the flu, right?
Well, we're going to learn more about, how contagious is new. So we're learning.
We're learning.
But it is contagious. All of us are susceptible because none of our immune systems have seen it before. We haven't had this. So when you have thousands of people in an arena, somebody's bound to have the virus, and then they're going to spread it to other people. And then those other people could be shedding the virus, spreading it for days before they knew. So that makes it really hard from a public health point of view.
Well, we want to say thank you to you and all the healthcare professionals, because this is unbelievable, and so we know they're working overtime. Thank you for your time.